Imagine a baby born with a heart defect so complicated that there is no simple textbook answer. Holes between the chambers, blood flowing in the wrong direction, vessels positioned differently. Traditionally, surgeons study CT scans, MRI images, clinical reports. These tools are powerful, but the surgeons still have to mentally reconstruct a living, breathing, three-dimensional heart from the images on the screen. And in a complex case, the uncertainty is frightening. So this is where Boston Children's Hospital became one of the leading pediatric centers, showing how patient-specific 3D modeling and computational simulation can move from research into real surgical planning for complex heart disease. Instead of only looking at images, the team can take the child's scan and build a digital model of that specific heart. The model can help the surgical teams understand the blood flow, evaluate pressure changes, and compare possible repair strategies before entering the operating room. So in one of the reported cases from May 2019, Boston Children's worked on a child with holes involving all 4 chambers of the heart, a highly complex case with no easy answer. The team created a digital model, tested 3 different repair strategies, studied the expected flow and pressure outcomes, chose the most promising approach, and rehearsed the plan before surgery. Then they operated. The repair worked as predicted. And this is a real shift. Innovation does not have to happen during the operation. It can happen before the operation, inside the model, before the first cut is made. By 2023, this approach had grown into a broader program for complex heart cases. By 24-25, Boston Children's started using advanced modeling, simulation, and surgical planning across many complex cardiac cases, including training and planning workflows. And the outcomes show why this matters. For the arterial switch procedure used for babies born with reverse arteries, Boston Children reported 60 cases with 100% survival. The success is because of the digital twin. Let's move on to our third case, which isn't just a crisis. It isn't a surgery. It's the world's most common chronic disease. Over 500 million people globally have type 2 diabetes. 1 in 10 adults in the US, and almost every single one of them gets the same advice on diagnosis day. Cut sugar, exercise, take this medication. You'll manage this for life. But here is the problem. Medicine has known for years and never solved. 2 people, same age, same diagnosis, give them the exact same treatment and they respond completely different. One reverses it with diet, another one needs 3 medications. The third needs none, just sleep and stress management. Why? Because every human metabolism is different. And for decades, medicine has been treating them all the same. In 2018, a company called Twin Health set out to change that. They built what they call a whole body digital twin, a real-time computational model of your individual metabolism. And here is what it does. You wear a continuous glucose monitor, a small sensor of your arm that track your blood sugar levels every minute around the clock without any needle pricks, and you pair it with fitness watch, scale, or a blood pressure cuff. Together, the platform captures up to 3,000 data points every single day across 174 health makers. That's 174 different measurements of how your body is functioning, from glucose to sleep quality to heart patterns. It builds a model for you, not the average diabetic patient, you specifically. The digital twin learns. When you eat rice, your blood pressure does this. When you sleep 6 hours instead of 8, your body's ability to process sugar, what your doctors call insulin sensitivity, changes like this. When you walk for 20 minutes after a meal, your post-meal glucose spike drops by this much. Then it predicts, then it personalizes. Every recommendation calibrated to your biology, updated in real time. So what happened when clinic put this into a rigorous test? 150 adults with type 2 diabetes, randomized controlled trial, meaning half got the digital twin, half got standard care, randomly assigned so that the results can be explained by luck. published in the New England Journal of Medicine Catalyst 2025 Aughts. And the results? 71% of patients using the digital twin achieved an HbA1c below 6.5. That's the clinical definition of reversal. 75% crossed that line while eliminating most of their medications. In the control group, the standard care, the way diabetes is treated everywhere right now, only 2.4% achieved the same result. Here's what else happened in the digital twin group. GLP-1 medications, drugs like Ozempic that have been taken by the world by storm and cost thousands of dollars a year, their use dropped from 41 to 6%. Insulin, the daily injection that millions of diabetics depend on, dropped from 24% to 13%. Weight loss was twice as high compared to the standard care. Over 500 million people are living with a disease that medicine says you manage for life. The studies say for the majority of patients, that's not inevitable. It's not a medication problem, it's a personalization problem. And a digital twin just solved it. And here is what gives me genuine hope. Digital twins are being actively built for cancer, brain disease, for conditions that have stumped medicine for decades. So digital twins aren't just a medical technology, it's a mirror that shows you your biology before disease does, your risks before symptoms do, your future before it arrives. For the first time in human history, medicine isn't just reacting to what it goes wrong, it's seeing it coming. So that shift is happening right now in real hospitals on real patients. But here is a question nobody is asking aloud enough. When your digital twin predicts something you do not want to know, do you look forward? When it tells your insurance companies you are at high risk, who will protect you? When it is wrong, who is responsible? The technology is very much getting there. The harder question is, are we